Loud from Texas for 5 minutes of questions.
Thank you, Chairman, and thank you all for being here to discuss the lessons learned throughout the COVID pandemic. Together, you all represent the bulk of the government's response to COVID, or you represent the agencies that were the bulk of the response. And the American people are very concerned about the government's response. You know, there was a lot of understanding in the first couple of weeks that this was novel and we had to figure it out. But once the outbreak kept going, we saw attempts to cover up failures. We saw blatantly politicized policymaking. We saw Americans getting deceptive advice while their civil liberties were being trampled on. Federal public health agencies promoted school closures that caused long-term learning loss and mental health problems, forced mask mandates on toddlers in the face of all scientific evidence. To the contrary, threatened Americans with the loss of their livelihood, their businesses were closed if they declined new and experimental vaccine, along with many other grievances that the people would have in the response that we had. Now, we got together on Tuesday just so the chairman could let us know that this hearing was going to happen, and someone asked the question. They said, what do you think the lessons learned are going to be in the testimony? And I kind of jokingly replied, well, I'm guessing like every other agency that makes a mistake or has failures in the federal government, they'll probably come and say, well, we need more money and more authorities. And that's by and large what the testimony was today. And I'm not saying those discussions don't need to happen at some point. I mean, it would be very suitable for the Appropriations Committee. But what we didn't see was an answer to these questions that remain outstanding for the American people. And in an effort to rebuild trust, it's very important that we answer these questions. Dr. Tabak, I wanted to ask you, one of the things that came up in much of our testimony, Dr. Fauci and Dr. Collins both indicated to this committee that even though their signatures appear on every grant, basically the process is you have people researching the grants, right, at a lower level, and basically they put it before a committee, a peer review committee that receives a priority score, then it goes to an advisory council, and then it goes to, at the time it was Dr. Fauci, for example, when we were talking about the NIH grant. Now, this is one of many cases, and I've seen this in agency after agency after agency. These are supposed to be multiple levers of accountability, and what happens is Dr. Fauci, for example, said, well, yeah, my name's on it, but, you know, I don't have time to read every grant, and that's kind of understandable. And well, then who is responsible for it? Well, it's this committee. Well, this committee votes on it and like block grants to the tune of even sometimes 100 grants at the same time. They don't actually read it either. And so we end up having these supposed multiple layers of accountability that turn into multiple layers of plausible deniability. So nobody ends up being held to account. And so when we're talking about lessons learned, these are the kind of systemic things within agencies that I would like to hear. What are we doing to fix these things? What are we doing to make sure that we don't tread on people's civil rights again? What are we doing to make sure that we don't threaten the licenses of medical professionals who are experts in the field but might have a differing view? These are the kind of things that I'm wondering, how are we going to make sure that the government stays in check so that we can begin to restore the trust of the American people? Could you speak to the grants system, and has anything been done about that? Because I brought this up in several committee hearings since then.
So again, you just describe the way grants are reviewed.
That's my point, though. My point is that needs to change. So, you know, we've brought this up in a number of committee hearings, how broke this process is. Are you doing anything to fix those things? Are you doing anything to fix these other, before you come and ask us for money, we still have a guy who committed perjury before Congress who's still there. Now, I understand some of that's statutory, and maybe we can work together to streamline that process. So I'm not putting that on you. But when it comes to, like, we're going to ask the American people to fund some of these ideas you have, right? I'm concerned about the government having more data, I will say. But what can we do, and I mean, feel free, any of you, to jump in to fix these systemic problems so we can, before we go ask the American people to fund this, what are we doing to fix the issues that tread on their rights, that took their jobs, that failed their businesses, that took their medical license, all these sorts of things?
Thank you. I would just start and say that we have reflected and looked at our internal processes and made a number of operational changes, including related to revamping our communication that I talked about, trying to clean up our website, make it more accessible. We've improved our test development process and had better partnerships with the private sector. We actually have mechanisms in place now where with the H5N1, we're trying to work with other partners, the private industry, to develop new tests for H5N1 and for oral pooch. We've refined our guidance processes and the way we're sharing with external partners and trying to standardize across all of CDC. And internal to CDC, when we deployed staff all around the nation, we had difficulty with the way we did that. So we've actually changed the way we actually are deploying our staff, and so all of our staff are moving towards operational readiness, readiness to respond. So we have made a number of changes at CDC.
My time's, I don't,
I will allow anyone else
Thank you.
to answer that.
Again, the changes we've made are to enhance our oversight of the awarded grants, because where we ran into difficulties was a failure to catch certain things along the way with the application that we talked a lot about in these hearings. And so we do have now more fail-safe signals within our system to prevent oversight of not having a progress report done in a timely manner, making sure that it's reviewed in a timely manner, and ensuring that we can't refund a grant if all the progress reports haven't been received and reviewed and signed off on. Those are the types of things that we've done.
Sure. We've certainly taken a look at a number of our practices throughout the pandemic. We've been building on what's worked and moving away from things that are maybe not as effective. So for example, trying to make sure that we are as transparent as we can be in our reviews, putting our work out, but then building on that and not just putting out a memo that's digestible to a certain portion of the population, but actually taking that a step further and doing that actually in concert with our colleagues at the CDC. Second, emergency use authorizations. Now everybody knows about EUAs, but coming into the pandemic, they had really only been used for Zika and Ebola diagnostics for the most part. So we learned a lot about emergency use authorizations and the importance of communicating early and often with manufacturers and putting out our thinking in advance so they weren't guessing about what we would need to see. And then third, as I said, supply chain. We have learned lessons about the gaps that we have in our understanding of where products are coming from and the vulnerability that that creates for the healthcare system.